Welcome to Wally Health and Wellbeing. Remember to like, subscribe and share. Remember to click the notification bell. Today let's talk about ulcer stomach. Ulcer stomach, which are also known by most people as gastric ulcers, are painful sores in the stomach lining. Ulcer stomachs are one type of peptic ulcer disease. Peptic ulcer stomachs are any kind of ulcers that affect both the stomach and small intestines. Ulcer stomach occurs when the thickness of the mucous membrane layer that protects your stomach from digestive juices is eroded. This allows the digestive juice to eat away at the tissues that line the stomach, causing an ulcer. Ulcer stomachs can be easily cured, but they can easily become severe without proper treatment. What causes ulcer stomach? Stomach ulcers are almost always caused by one of the following factors. After being infected with the bacterium Helicobacter pylori, H. pylori. Infection from H. pylori is usually as a result of not washing hands. Feces from the hands get transferred to the mouth. Other causes are contaminated water and contact with animals. These germs, after entering your body, lives in your digestive tract. Many years after, they tend to cause sores, also called ulcers. In the lining of your stomach or part of the upper lining of the small intestine. It also said that long-term use of non-steroidal anti-inflammatory drugs, such as aspirin, ibuprofen, or naproxen, on very rare occasions, a condition known as Cinderella syndrome, can cause stomach and intestinal ulcers, by simply increasing the body's production of acid. This syndrome is suspected to cause less than 1% of all ulcers stomach. Symptoms of ulcer stomach. A number of symptoms are said to have been linked to stomach ulcers. The severity of your ulcer symptoms really depends on the severity of the ulcer itself. The most common of symptoms is a burning sensation or pain in the middle of your stomach between your chest and belly button. Typically, the pain will be more intense, mainly because your stomach is empty, and it can last from anywhere between a few minutes to several hours. Slight pain in the stomach, weight loss, not wanting to eat because of pain, nausea or vomiting, bloating, feeling easily full, burping or acid reflux, heartburn, which is a burning sensation in the chest. Pain that may improve when you eat, drink, or take antacids, anemia, whose symptoms can include tiredness, shortness of breath, paler skin, dark, tarry stools, vomit that's bloody or looks like coffee grounds. Talk to your medical professional if you have any symptoms of the above-mentioned stomach ulcer, even though your discomfort may be mild at this point. Ulcers can worsen as time passes. If they aren't treated soon, a bleeding stomach ulcer can become life-threatening if not attended to. How are ulcer stomachs diagnosed? Diagnosis and treatment will surely depend on your symptoms and the severity of your ulcer. To diagnose a stomach ulcer, the doctor will have to review your medical record, along with any symptoms and any prescription or over-the-counter medications you're currently taking. To rule out possibly H. pylori infection, blood, stool, or breath test may be ordered to rule this one out. With a simple breath test, you'll be instructed to drink a clear liquid and breathe into a bag, which is then sealed. If by any chance H. pylori are present, the breath sample will now contain higher than normal concentrations levels of carbon dioxide. Other tests and procedures that is used to diagnose ulcer stomach include barium. Your doctor will give you a thick white liquid, barium, to drink, that coats your upper gastrointestinal tract and helps your doctor see your stomach and small intestine on X-rays. Endoscopy, a thin, lighted tube that is inserted through your mouth and into the stomach and the first part of the small intestine. This test is used to look for ulcers inside your stomach for bleeding or any tissue that looks abnormal. Endoscopic biopsy, a piece of stomach tissue that is removed to be analyzed in a lab. Explore the interactive 3D diagram below to learn more about ulcers stomach. Treating your ulcer's stomach. Treatment may more often vary depending on the cause of your ulcer. Most signs of ulcers can be treated with a prescription from your doctor, but in rare cases, you may be required to have surgery. It's important to promptly treat your ulcer. Talk to your doctor to discuss which treatment plan is best to treat your ulcer. If you ever have an active bleeding ulcer, you'll likely be hospitalized for intensive emergency treatment with endoscopy and IV ulcer medications. You may also need a blood transfusion just in case. Treating your ulcer stomach naturally. Drink 3 times a day, and especially before your main meal, drink a puree of raw Irish potatoes, celery and carrots. This mixture is alkaline and rich in potassium. Take supplements of turmeric, zinc and glutamine. Use natural antibiotics such as garlic, onion, rosemary, thyme and ginger. Non-surgical treatment. If your ulcer stomach was the result of H. pylori, you'll need antibiotics and a drug called proton pump inhibitors, which block the stomach cells from producing acid. Simple treatments include basic lifestyle changes, such as quitting smoking, avoiding alcohol, aspirin, and non-steroidal anti-inflammatory drugs. Symptoms of an ulcer may subside quickly with a treatment regimen. But remember, even if your symptoms disappear, you should continue to take any medication prescribed by your medical doctor. This is especially important with H. pylori infections, to make sure that all bacteria are eliminated from your stomach. Side effects of medications that are used to treat ulcer stomach may include nausea, dizziness, headaches, diarrhea, abdominal pain. These side effects are usually temporary. If any of these side effects should ever cause discomfort, talk to your doctor about changing the medication. Home remedies for ulcers stomach. In addition to eating healthy foods, the following food items may be of help: reducing the effects of H. pylori, the bacteria responsible for many ulcer stomachs. However, the below supplements are not in any way intended to replace prescription medication or your current treatment regimen. They include probiotics, honey, glutamine, food sources like chicken, fish, eggs, spinach, cabbage, beef, dairy products, vegetables like beans, carrots and parsley. Vegetable juices like papaya, Brussels sprouts, celery, kale, and fermented foods like miso. Consider talking to your doctor about these natural and home remedies for ulcers on how well they may work for you. If any of these symptoms occur, be sure to call your doctor right away. Symptoms like weakness, trouble breathing, red or black vomit or stools, sudden, sharp pain in your abdomen that doesn't seem to go away. How to prevent ulcer stomach. To help in the prevention and the spreading of bacteria that might cause a stomach ulcer, wash your hands with soap and water on a regular basis, especially after using the toilet. Also remember to surely thoroughly wash and clean all of your food and properly cook it as needed. To prevent ulcers that are mainly caused by non-steroidal anti-inflammatory drugs, stop using these medications altogether, if possible, or limit their use. Make sure to always take these medications, and any medication with food, and adequate liquids. Stay tuned for my next video. Natural and home remedies for ulcers. Medical disclaimer. This video content is not intended to be a substitute for professional medical advice, diagnosis or treatment. Please consult with your physician with any question regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you watched in this video. Thank you for watching. Please like, subscribe, and comment. Click the notification bell so you'll be notified when a new video is published.